Good morning and welcome to this week's Access to the Source, Reopening Missouri. We are extremely excited about this webinar and the conference call information that we have from our special guest. My name is Andrea Seitz and I serve as the President and CEO for Show Me Christian County. We do ask that all of our participants remove your video and keep your audio on mute. To make sure that this is the most secure line as possible, this will be in a conference call format. So today joining us, we have Kyle Aubuchon, who is a top advisor to the governor. We have Director Randall Williams that serves as the Director for Missouri Department's Health and Senior Services, and also Representative Lynn Morris, representing District 140. And we are excited about the information that these gentlemen have for us today. It is International Economic Development Week, and how fitting that we are reopening Missouri during International Economic Development Week. And so without further ado, we'll kick it off and start with Kyle Aubuchon. So Kyle, to you.
So good morning. I appreciate the invite and thanks for having me here today. Really excited to share a little bit of information about the governor's Show Me Strong Recovery Plan and the phase one part of that, as well as looking forward to the future. So, Governor Parson, as we've been dealing with the COVID-19 crisis, we definitely have to deal with the healthcare and public safety aspect. But as the governor, have to also look at a broader picture and looking at the economy, unemployment, our businesses and communities, and how everything along those lines has also been affected by this. So towards the end of April, he announced the Show Me Strong Recovery Plan, phase one, that went into effect on Monday, and it runs through May 31st, Sunday, May 31st. So a lot of our previous health orders, like our Stay Home Missouri order, only lasted a couple of weeks so we could constantly reevaluate the data. With this plan, we extended it through the end of the month to kind of give communities and citizens and businesses a little bit more certainty and stability under knowing what parameters they were going to be operating under for a little bit more of an extended period of time. So this plan that the governor has announced is very strategic and a deliberate gradual reopening of our economy based on Missouri healthcare data. On a daily basis, sometimes more than once a day, we look at our healthcare system and what capacity we have and if we're able to fight COVID-19. We look at, how many beds our hospitals have available, ICU beds, ventilators, how many admitted patients they have. And we look at that information every day, sometimes multiple times a day. A lot of the reason for the shelter in place or the stay home orders throughout the country and even in counties throughout the state, is to help flatten the curve to make sure our healthcare system would not get overrun or overburdened. It wasn't designed to eliminate it to where we have zero cases altogether. And we're cautiously optimistic that we have flattened that curve. And as that has happened, we're looking to get people back to work and kind of get the economy going again while still fighting COVID-19 and making sure that public safety and health is at the top of that list. The governor's health order and an accompanying document are frequently asked questions or some guidance on how to interpret that health order are found on the governor's website as well as our Department of Health and Senior Services website. So a lot of counties, when they did their public health orders, you'll see that they may have been 10 to 12 pages long and, got 8 pages worth of exemptions. Our order is 2 pages long and very simple to read. It's some broad guidelines that applies to the whole state and allows for a lot of flexibility for communities like yours. If, some communities are a little bit farther along on the recovery aspect, some are still more of a thick in the fight. So this plan the governor has created flexibility to allow local communities to adapt it to their needs and their situation, whether or not they need to have a little bit more restrictions if it's appropriate for that. A lot of questions that we've gotten that we addressed in our order are like places of worship and churches. We're starting to allow in-person services again, but you have to abide by social distancing, which is 6 feet apart. I think over the next several weeks, regardless of what goes on, social distancing is going to be a part of our normal life or our new normal for a long time. So that's something to keep in mind. we also have guidance about, what if your job requires you to be less than 6 feet from someone, such as working in a salon or a gym or a barber shop. We offer some guidance about that. The health order does allow for an exemption, so those businesses can operate. We encourage them to take strong sanitation measures and public health and safety measures to protect their employees and to protect their customers. Some of the things that have stayed the same in the health order, we're still prohibiting access to things like nursing homes and long-term care facilities to protect those vulnerable populations and those most at risk. We did put an exemption in there for end-of-life situations. We also still have some occupancy limits on retailers like grocery stores and some of the big box stores. That stayed on from our Stay Home Missouri order. When the federal government was doing their guidance, they listed a lot of essential businesses or what they considered to be essential businesses. One of Governor Parson's biggest things that he thought about when he did that Stay Home Missouri order was, who is he to tell someone whose business is essential or not? We're about to see record unemployment numbers, and, a lot of those people filing for unemployment, I think a lot of them and their families, they thought their jobs were essential in some of these businesses. So, while you may have seen a big box store have no limits on who can go in, and while other mom and pop stores on Main Street were closing, Governor Parson, took that to heart and wanted to really see how, we can make the situation better. So, those bigger stores and retailers still have some occupancy limits to help limit the amount of traffic and minimize human contact. Restaurants were another big aspect. A lot of restaurants did a lot of curbside delivery, pickup, or takeout orders. We've tried to help them with that. We're allowing in-dining services now as long as all the tables are 6 feet apart. On top of that, they're taking increased sanitation measures. I know a lot of restaurant owners who have said that their restaurants are probably as cleaner than they've ever been since they've been open. It's kind of to bring businesses back. It's definitely a partnership between citizens and business owners and community leaders, a partnership. And I say that because, we could have let businesses reopen or a restaurant have in-dining services, but if those businesses aren't taking precautionary measures, customers aren't going to come back yet to them. So it's a balance, it's a partnership, and you're going to see a lot of effort on businesses aspects to make their employees healthy and safe, and provide a safe environment for their customers, and kind of restore some confidence. So as I mentioned, we built in some measures for local control. So as I mentioned earlier, not all communities are at the same place right now. What works good in Christian County, is probably not good for St. Louis County or Jackson County, or even, Greene County, which is just north of you guys up 65. Each community has its different needs. So we've kind of built in some options to give flexibility to make sure every community can fight COVID-19 the way they see fit or what's appropriate for them. In addition to our public health order that runs through May 31st, we also issued a guidance document that can also be found online, and it kind of helps everyday citizens and business owners interpret the public health order and address some FAQs. For example, we've added some things in there about waiting rooms, whether it's like at a doctor's office or a hair salon or a restaurant. We've encouraged if you have an appointment to get your hair cut or a dental visit, instead of waiting in the waiting room and touching all the magazines on the table, waiting in your car if that's possible until your appointment comes. We've encouraged businesses to maybe cut back on the seating in some of those environments just to limit human interaction and make sure everyone is as safe as possible. We also have some guidance in there. We get a lot of questions about organized sports like a Parks and Rec League or youth camps. I think you're going to see over the next couple of weeks, we've got some guidance now, but we're going to give some further guidance. And that guidance is a reflection of getting stakeholder input saying, we've got a lot of questions about this, so we're going to kind of help clarify that and working with our Department of Health on it. Lastly, we also have some guidance about, events at larger venues, things like wedding receptions or graduation ceremonies. We're allowing those events to take place. with the condition that social distancing is a part of that. As I mentioned earlier, there's an exemption for social distancing if your job requires you to be within 6 feet of each other. There's also an exemption for family members as well. So if you go to a church on Sunday, your family of 7 can all sit next to each other, but then that next family's got to be 6 feet away. So, just because we're allowing a lot of businesses to reopen or restart, doesn't actually mean it'll happen. A lot of businesses are making the decision for themselves, what is feasible for them. Can they provide a safe environment for their employees and their customers? So, Governor Parson on Monday and today, he was in Joplin and Springfield on Monday, and he's in Jeff City today, touring some businesses, seeing how they've adapted to COVID-19. He's been very impressed with the measures being taken by the business community to provide those safe environments and the actions they're taking. So, and then just a little bit additional information to wrap us up on my end. We starting yesterday, a lot of county governments received some deposits from the state treasurer's office with federal dollars from the CARES Act. Christian County got $10.3 million out of that, and that money is allocated from the federal government to the state. And with the work of the state legislature through the supplemental budget, they kind of came up with a formula to get that money out, and they told the governor's office to get that money out to the counties within 10 days once we received it. So we're very proud that we worked with them and we got that money distributed. The best mechanism that we came up with was to use the county governments to receive that money. These federal funds, it's very important that they are related and it can be used for COVID-19 expenditures only. So, there's a lot of discussion about a lot of local governments, county governments, as well as state government. We've suffered from a lot of revenue loss, whether income or sales tax. These federal funds cannot be used just to backfill your operating budget. It has to be used for COVID-19 expenditures only. So we're encouraging the county governments to start working now with their mayors and their municipalities. I know, I'm sure Nixa at Ozark will be reaching out to the county commission soon to work on how they can get some of that federal funds for their COVID-19 expenditures. We're also encouraging them to look at funding their local public health authorities and working with them to see what they need. If they need additional PPE or money for contact tracing or testing needs, that there's some funds available for that. The federal government has told us that they will be auditing the expenditures of these funds, so it's important to document and write down receipts of how this money is being used. Otherwise, we don't want to see any counties have to return any funds that weren't used appropriately. The CARES Act also allowed, they had some different pots of money as well. They had a pot of money for some school districts to help them with their payroll and expenses. Those payments have already been made. There's also some money for child care. So if there's any business owners or employees that are struggling with child care and need some resources, our Department of Social Services has information on that on their website, or you can call them that they can try to connect you with the child care provider or see what options are there as mom and dads and people start going back to work. So the Department of Economic Development also, we've worked with the Small Business Association on the Paycheck Protection Program funds that are still available. These are some funds to help cover payroll, rent, mortgages, utilities. A lot of businesses, it's encouraged to work with their bank on this application process. Missouri was one of the first states in the country to get a disaster declaration from the federal government to access some of these funds. We were one of the first ones that we're really proud of, and we got a statewide declaration really early on in March, and that's kind of helped us be ahead of the curve on that. One last thing to think about is that these federal funds right now, they are supposed to last you until December 31st through the end of the year. So, when you're planning and budgeting next fiscal year, that's an important thing to keep in mind. Here in the governor's office, we have weekly conference calls with a lot of different stakeholders and groups. When we announced our Show Me Strong Recovery Plan, we reached out to some Chamber of Commerce's and the Associated Industries of Missouri, the Missouri Restaurant Association. We kind of ran some of our broad guidelines and advice by them to make sure that we would have some buy-in And that's been really helpful as this week has started out. We've had a good reception to our guidance and our health order, and we appreciate that buy-in. The governor also participates in weekly conference calls with our federal delegation, our U.S. Senators Roy Blunt and Josh Hawley, as well as Congressman Billy Long and our other congressmen and women of the state to get an update on the federal level. From what I gathered yesterday on their last call, the U.S. Senate is in session right now. The House is not. There's been talk about doing another stimulus bill and what that would look like. A lot of governors and local leaders have talked about, just how with the sales tax being down, if they can get some kind of support to backfill some operating budgets. So Washington, D.C. is kind of debating that. Some other senators would like to see that money spent more on specific projects and not just revenue loss, like an infrastructure package. So it's still kind of early to tell how that's going to play out. And there's some feeling, too, that they want to see how this first round of stimulus money goes. We just got the CARES Act money into the county governments yesterday, so I kind of want to see what the effect of that is and how it's being distributed amongst the municipalities. And just to wrap up, Andrea, I appreciate you letting me talk for as long as I have. From our office and the governor's office, as we do our daily briefings, one of the main messages the governor's been pushing over the last few days, and prior to that as well, is the importance of shopping local. Missouri is one of only a couple states that doesn't have like the Wayfair provision or collect revenue from online purchases, which, now going through this pandemic, it's kind of, we look back and thinking, what a great tool in our tool belt that would have been. So, we're really promoting our local businesses, telling people to shop local, spend their money in their communities. If there's a family that wants to go out to eat, maybe they're not ready to go into a restaurant yet, but they can definitely get, curbside pickup or delivery, and kind of encouraging that message, because that's how we're going to, I talked about that partnership between businesses, their business owners, their employees, the customers, community leaders. The state government and the governor's office is part of that partnership, and we're going to continue to provide as much resources and information as we can. And I appreciate all the time you've given me to talk. Thank you.
It's our pleasure. And Kyle, thank you so much for the update and for making it very specific to Christian County. That really reaffirms the fact that in the governor's office and all across the state that you're looking at that individualized approach, and we do so greatly appreciate it. Next, we'll move on to Dr. Randall Williams. And again, Dr. Williams was appointed as the Cabinet Director of the Health and Senior Services and was subsequently unanimously confirmed by the Missouri Senate on March 9th, 2017. He believes a fundamental tenet of effective leadership is to be readily available and accessible. And he has visited all of Missouri's counties to listen and learn from all of Missouri's citizens. And Dr. Williams, I know that experience is coming in handy through the COVID-19 crisis. Thank you so much for joining us this morning, and we're looking forward to your update from the health side of things.
Well, thank you so much. And it really does. As the governor always says, it's a very diverse state. And one thing that concerns me as we make policies is I think sometimes people, especially from urban areas, don't really appreciate the Christian counties and the Worth counties and Gentry counties and Howell counties. And so I know that in my travels, I have a great appreciation for the whole state. So just to update you, we've been fortunate here in Missouri to not have the burden of disease that some other states have, like Illinois to our east, and Louisiana and New York and New Jersey. We've been very purposeful about testing and using that testing both to help patients and to drive policy. So as we open up, we are on the flat part of the curve, which is a good thing. Right now, we were very encouraged last week. We just went in and did about 3,000 tests randomly, some in your area, just to see if you asked them to come in and be tested, what you would see as we got out of community transmission. And out of about 3,000 tests throughout Missouri, we had 9 positive. And I think 4 or 5 of those were in one place in the 3rd Ward of Kansas City. So when people ask me if you went in and just looked at a big venue, how many people would be positive, that gave us a little bit of an idea. I think the number we walk around with is probably about 1 in 20, and that would obviously be different in St. Louis County and St. Louis City, where more than half of our cases have been, than it would be Christian County. But, and we'll be doing more testing coming up. So right now, our testing strategy is very much developing what we call a boxed-in model, which is we know that we will continue to see outbreaks, especially in long-term care facilities, where much of our morbidity and mortality comes from in Missouri. And when we look at the number of people who died, many of them have come from those venues. So we've developed a strategy that we've used in Jefferson County and in our prisons, and we've used in Triumph Foods up in Buchanan County last week, where we go in when we have an outbreak and test everybody, symptomatic, asymptomatic, staff, patients. And we have found that to be very successful, and that's very different than what we would have done 3 weeks ago. So my advice to you as county leaders is that you use some of your COVID-19 funding as we move forward to develop a plan that you could help your long-term care facilities with funding as part of that boxed-in strategy, that you would have the ability. Now, be aware that insurance pays for these tests, that you know, Medicare and Medicaid, it's no expense to the patient or the staff if they have Medicare or Medicaid, and private insurance. This is a preventive code. So we're developing a model where if we had an outbreak in a long-term care facility in Christian County, we would come in as a state and arrange for testing with a local provider, FQHC, hospital, private provider, but insurance, the patient's insurance would pay for that test, whether it be Medicaid, Medicare, or their private insurance, and the state would backfill if needed. The other plug I'd put in just very quickly is I've always, when I testified for the Senate and the House back in March, and yesterday was the 100th day that we've had our incident management team stood up. We've been at this for 100 days. Our first case in Missouri was March 7th, but we've been at this since January 27th in my department. I've always said that we would do well here in Missouri because I thought our hospitals, our providers, and our local health departments, adopting a whole government approach, that we would be prepared for what came our way. And that was based on a 2018 flu pandemic plan that we had and had looked at that. And that has proven to be true. But the backbone of that, whether I'm at the White House discussing this or in Congress or here, are our local health departments. And they have been true heroes in standing up more than 150 mobile testing sites from scratch here in Missouri to give people access to testing. So we certainly hope and encourage them to submit to the county commissioners and others the number of people they diverted from their normal work to handle COVID-19 and to build up capacity should we have more cases in the winter of next year, should we not get a vaccine developed in time. And we ask your consideration of their needs as you look at your first responders and those. So I'll stop there and turn it over to Representative Morris, but happy to answer any questions at the end of that if you'd like me to. Thank you.
Thank you, Dr. Williams. And if anyone does have a question, you can submit that through the chat window. That will probably be the easiest way for us to monitor and manage those. While we're waiting for some questions to roll in, Lynn, I know that you're sitting there, and thank you so much for helping us get these gentlemen on the calendar and available to our citizens here in Christian County. And I know that this is definitely not how you anticipated your last term as state representative. So can you tell us a little bit about what's going on for you and what this is looking like through your last term serving?
Well, Andrea, thank you so much, and Sarah, and for everyone else online today. You're exactly right. I don't think any of us would have ever dreamed that our lives would be affected like they are. This is my last year. It's been an honor and a privilege to serve Christian County and all of Southwest Missouri. It's been an interesting ride. And obviously this last year, I now know how the seniors graduating from high school and college and all the athletes that are wanting to compete in that last tournament and they don't get to, now I know how they all feel. Because it's the same way for me. I had several bills that the first of the session, we were moving fast. We thought we had a strong session going on. We had a lot of good ideas. The governor had plans, departments had plans, the legislative body had plans, and then all of a sudden, everything got shut down. And we lost 6 important weeks, including the spring break. And from that point on, our momentum has not gotten back to where it needs to be. And unfortunately, but good for our state, and that's what we need to do. Constitutionally, the only thing that we have to do each year as a legislative body is pass a balanced budget. And this year was extremely the hardest budget that I've seen in my 8 years. I've had 3 years of shortfalls. I've had 3 years of plus money that we could work with. I had 1 year that was basically about even. So this year was the shortest largest shortfall that we've had, and it's not fun to start trying to figure out how you're going to cut money out of every department. Every aspect of our state is important, and so people have come up all session long wanting money, needing money, and then all of a sudden we don't have that money, and we have to start cutting programs. And so that's probably one of the worst parts of my job, but absolutely the most important thing is because I am proud that the state of Missouri has a balanced budget, that's in our Constitution, because many of our states don't do that. They practice their fiscal responsibilities by borrowing money all the time, and I don't think that's what we want to do in Missouri. So we did. We mostly have worked on the supplemental budget. We got it passed. That got us through till the end of this fiscal year. Our new fiscal year starts not very long from now, July 1. So it's going to be here before we know it, and that's what we're working on right now. Our goal is to get the budget. The Senate has sent it back to us. As usual, they've made amendments on every one of the House budget bills, and it's been taken to conference today, and they'll work out those differences. They'll be voted back on again. Our goal is to give it to the governor by tomorrow. That's the constitutional requirement, is to give it to the governor by tomorrow. And then we're hoping that in June, the thought is that the federal government may come through and give states, but we'll just say Missouri, that's what we're interested in, is some additional money. And if the additional money, COVID money, is not completely tagged to specific things that we have to spend it on, we're hoping that we can go back and backfill some of our budget. I know the governor may call us in for a special session in June to do that. We'll all be glad to come back up and take care of some of the holes and gaps that we have in the budget and do that. Otherwise, I want to tell you a little bit about how different this session is than the other 7 end of sessions. Usually the last 2 weeks in my first 7 years, we'll work till 10, 12, midnight, 2 in the morning on bills, just about every night for about 2 weeks. And when this year, May 15th is our last day. At 5 p.m. on May 15th, you can have a bill that has already been debated on the floor, and you've called for the vote, and you're voting, but if you do not have it tabulated by the time the bell rings, the bill fails. And so usually we're in such a race at the end to get bills, working with the House, working with the Senate, working with different departments, trying to get these bills passed. This year's a little different. You'll have to ask me again next Friday what I think, but right now I'm worried. We keep doing the budget. We did 4 more appropriation budget bills yesterday, and that's fine. That's what we need to do. But we haven't passed one bill yet. Now, what we have to be careful for is at this time of year, we have a lot of people trying to put their bills on as amendments. So, for example, we had one bill Senate Bill 600 that has 41 amendments. There are really actually 41 bills. Usually an amendment is done during the year and you've actually amended something on a bill. But this is actual bills, and so many times that makes these original bills many pages, several hundred pages. And unfortunately what happens almost every time is you'll have some good bills and then you'll have a bad bill or two, and then pretty soon it taints the whole bill and everything fails. So at this point, we haven't passed any other bill, and I'm really disappointed when I heard Kyle talking about Wayfair, streamlined sales tax. You know, this was a priority for us at the first of the year. I believe it was a priority for the governor's office. I believe it was a priority for just about everybody. Every town in every county wanted us to do that. We have not taken it up this week. We only have 2 days left this week and 5 next week, and we haven't taken it up. There is some thought that Representative Eggleston's bill that he's worked with the Senate might have the most, a bigger chance to pass. I like Representative Warren Love's bill, but we haven't heard either one of those bills yet. So I'll be working with the Speaker of the House today with some other individuals, going to see him to try to figure out how we can shake loose some of these priority bills before next Friday and see if we can get them passed. I don't think it's too late yet, but the time is running out, and we've got to get that done. And I think that's one of the biggest economic tools that we could have done. Too bad we didn't already have it done. We've talked about it for 3 or 4 years, and for a while there was a time when I don't really think a lot of people had confidence in the software systems and the companies out there that could actually track and record and distribute the monies properly back to each county, each municipality in those counties and the state. But now we do. We actually have. That's no excuse anymore. We should get that done. So that's why we're going to be talking to Speaker Hart today on that. As far as myself, I've got a couple bills still in play. I've got a veterans bill that should be voted out, but we'll see. You never know. And I've got a professional CE bill, healthcare bill that should be voted out. But again, we never know. And other than that, the most disappointing thing I've had is I had an uninsured motorist bill that I've been working on for 4 years. And when we first started, I had a multi-million-dollar fiscal note, and we got it down to 0. So I had 0 fiscal note, and the governor's office liked it. I'd been working with Harry Otto and several other guys in the governor's office. Department of Revenue liked it. Public Safety liked it. Economic insurance liked it. I mean, so we thought we had a bill that would actually save a few $100 million a year to the state, as well as save insurance premiums on every individual. We have a growing problem with uninsured motorists in this state. So I've been working on that bill, but unfortunately, it looks like we're going to run out of time. We're still praying that. But anyway, so that's where I stand, and I'll be glad to answer any questions too.
Thank you so much for that update. And we have had several questions roll in for Dr. Williams, and I'll get started on those. We want to be mindful of all of your time. The first question from our Christian County Treasurer, specifically about the suggestions for disbursement of the 2020 CARES Act stimulus. Dr. Williams, you mentioned suggesting a plan to assist long-term care facilities. Do you have any other recommendations for how those funds could best be spent?
Yeah, I think certainly contact tracing. Each county is different. Some counties like to do their own contact tracing. And so I would highly encourage, because if you don't spend those funds for COVID-19, they get reverted back. So I would certainly talk to your local county and see if they would like to do their own contact tracing and spend the money for that capacity. Certainly I would spend that money to, many of them got diverted from what they normally do, and that money can be appropriately spent to pay for that. So I'd sit down with them and make sure you get itemized all the things that they were doing that was related to COVID-19 and all the things they want to do going forward. And that will be stuff like, we will be very aggressively vaccinating for flu season next year, since only 45% of Americans get flu vaccines, and that could be a big issue next year, as Bob Redfield, the CDC director, has said. So I would sit down with them and be very thorough and comprehensive so that you are able to keep all that funding that you get if it has to be spent on COVID-19. We get questions all the time from St. Louis County and St. Louis City going, why are these counties that didn't have as much burden of disease getting this amount of money per capita? And our answer to that always is that, well, that might be true now, but we can't speak to what's going to happen going forward, and that your local health departments need to be prepared going forward. Thank you.
Yes, and we have a couple complementary questions to that. In your talks around the state, what are some of the biggest needs or potentially gaps in our system that county health departments have brought to your attention that's really helping to shape the strategy moving forward?
Yeah, I think the two that I just mentioned, I think it is, testing in long-term care facilities. What we're doing now is called comprehensive testing, where we test everybody. So I would certainly take an inventory of how many long-term care facilities you have in your community and kind of look at what capacity you need to do if you have an outbreak, which we define as 2 or more cases among staff or patients, and you do that comprehensive testing. I would look at mobile testing sites. We have 150 in Missouri. What does it take to stand those up? What expenses you'll need there? And then, as we mentioned, the contact tracing. What do you need to do in your county to either beef that up or to support it, should you want to do that? The state is going to hire 1,000, but we also are very interested in having money given to you, if that's what you choose to do, to do your own contact tracing.
Thank you. And for clarification, you mentioned that these funds are meant to last through the end of the year. So does that mean the $10.3 million allocated to Christian County needs to be spent and actualized by December 31st?
The short answer to that is yes. So I would say the county probably shouldn't, spend it all right now, but they need to start putting that process in place for your municipalities like Nixa and Billings and Ozark to acquire some of those funds for some of the things I talked about, like PPE or contact tracing, as Dr. Williams mentioned, that it needs to be spent on COVID-19 related expenditures only, not backfilling operating budgets or revenue loss. So the county commission should be working with the local leaders to identify those needs and finding a way to be able to help contribute financially to some of those needs.
Thank you. And I know, both of our city administrators from our larger municipalities and our mayors are on this call, and so we appreciate you bringing that information directly to us. I've got 2 more questions for you. The last, kind of again complementing towards the testing question, there's been a lot of speculation on a second wave, or what happens, once things start to reopen if we see very large spikes in this. The question is specifically, what are those trigger points that we're looking for to determine whether or not we would have to bring back stay-at-home orders?
Yeah, I think we watch very, very closely because we do a lot of testing. What we think would happen would be that you would see surges in different areas, different communities. To date, it has been largely an urban disease in the United States: New Orleans, Chicago, New York, Seattle. We've certainly seen some rural, but it's to date. So we certainly will be looking at our urban areas. We will very much be concentrating on our congregated living facilities, prisons, meatpacking plants, nursing homes. Those are kind of our sentinel areas that we watch very closely. The R-naught for the disease now is less than 1 in Missouri, meaning that as far as community transmission goes right now, it is not considered community transmission at the moment. But we watch that data across the state. We get it within 24 hours every day. If we see that changing statewide, then we would have to rethink things. But we think what's more likely is that we will go in and put out fires, so to speak, as they arise in different points throughout the state.
Thank you. A question came in specifically from a healthcare provider that is in the nonprofit world. Jackie Barger is the director for the Children's Smile Center here in Christian County. He said to Representative Morris and Dr. Williams, he is grateful specifically to Alex Tuttle and his team for the help in getting PPE to the health providers. They are on the list and waiting to receive orders from the state of Missouri. Is there anything to help expedite that process, either for these nonprofits providing healthcare or for some of our larger facilities? And kind of a tailor on or tag on to that question, any word from the budget process on funding levels being maintained for healthcare providers paid by Medicaid?
I'll answer a little bit of that question, which is that we are clearly planning to spend the next couple of months stockpiling PPE. And as the governor said, we are committed to being dependent on Missouri and Missouri only, and not China or the federal government for that. And so, you know, to your point, what we found out with this is that everybody didn't have enough PPE: coroners, medical examiners, long-term care facilities, first responders, hospitals, you name it. The list was almost infinite of people who needed more PPE. And so we will clearly be spending the next couple of months as a state stockpiling that, and certainly would encourage counties to spend their COVID-19 money thinking about everybody in that universe in your county who needs it. Funeral homeowners, grocery stores. I mean, we heard it from everybody. So I would certainly, before I turned any money back, I would make sure that I had enough PPE for that entire universe: grocery stores, nursing homes, nurses, private physicians, everybody.
And Andrea, I might just add that, you know, this is a good example. Anybody in Christian County, if you've got any needs at all, and you don't know who to call me. Call me either at my office or email me personally, whatever, and make sure, because what happens is each of us legislators have liaisons with each of the different departments. These liaisons do a great job. So Alex Tuttle, once I got a call from Jackie Barger's office that they needed equipment, I relayed that back to Alex Tuttle with Health and Senior Services, and then he gets right to work and helps people. Another example was when Jackie Barger had Smile Center had a problem with reimbursements and things like that. I brought Jackie Barger and his staff up to Jefferson City to my office and met with Todd Richardson, the top guy in the state with social services. So you know, this is what we have to do and need to do, and we can do it quickly if you'll just contact my office. The liaisons are very good, the departments are very good. The only thing I worry about is like right now, and maybe Kyle could help, and the doctor can help answer this, because I've had several constituents ask me that own businesses, they've been told to buy a thermometer, you know, these thermometers, and they used to be, because I know in my pharmacies, we used to sell them for $50 or $60. Then they went up to $100, $200, $300. Now some of them are $400 and $500 for the same ones that sold for $60, and you can't even get them. But if you can't open your office back up because you don't have a thermometer, what are we going to do with those type of shortages?
Yeah, that's a great point. I had not been talking about thermometers, but I'm going to start talking about thermometers. So that's a great point, Representative Morris.
Yeah, so I just worry about the businesses. I mean, sooner or later, we're going to work our way back in. I just know that hand sanitizers, I heard on the news this morning that they're finally going to start getting back in the shelves of stores. You know, you couldn't get them and things like that. But we've got to learn from all of this, because we will surely have another pandemic someday, and we've got to be ready for this. But I'm going to be trying to help businesses find thermometers and things like that. So I'll take on that responsibility and work with these individuals to do that.
Yes, and as a reminder to our participants and our business leaders, Director Dixon and the team at the Department of Economic Development has done great work with Google and setting up a PPE marketplace. That link is on our website at showmeccmo.com. Gentlemen, we have one last question, and that is about food supply. Director Williams, you've mentioned a couple of times that there have been outbreaks in some processing plants and different things of that nature. At this point in time, do you feel like the food supply chain in Missouri is secure?
I do. You know, you hear national stories about Costco and others limiting the amount of meat. My sense is we are stable here in Missouri, and I think that will just get better. I really do. Thank goodness. As you know, we were very aggressive up at Triumph Foods, tested 3,000 people. Sadly, they had a death yesterday from somebody who got infected April 22nd. I've been on the phone with them this morning, and very sorry to hear that. But on the other hand, there are 3,000 employees there, and 412 tested positive, and I think we've helped keep them healthy, and so we're thankful for that. So I think for food supply, we'll be okay, and it will get better.
Wonderful. Well, gentlemen, I sincerely cannot thank you enough. You've been very generous with your time and with your answers, and very transparent in the information, getting that out to our citizens. Again, as a reminder to everyone, this recording will be posted on our website, again, at showmeccmo.com. If you have any additional questions, you can also send those to info@showmeccmo.com, and we will do our best to get those answers for you from our state partners. Gentlemen, thank you so much. And we hope you all have a great day. Stay safe and stay well.
Thank you.
Very good. Can we get Jesselyn to take